Oh, excuse me, I have dry mouth. I was just getting ready to take care of that for you. So, because, hey, dry mouth affects like 10% of the population, and it has a really interesting name, XEROSTOMIA. Okay, I just made that up, and I'm not sure it's right. But Dr. Jason Campbell knows, right?
It's good stuff.
Was I close?
You were close. XEROSTOMIA.
XEROSTOMIA.
XEROSTOMIA, no spit, is essentially, basically
That's
what
good. Is
we're
Latin,
talking about.
right?
Yeah,
I
right?
love that. See, I never took Latin. I didn't start out as Catholic. So XEROSTOMIA, I may have to take that.
One of the new curriculums for our Humboldt School District, learning Latin in their education.
I love it. So who does this affect, this dry mouth thing?
Do you know, it's crazy, and it really depends. It can affect any age population across the board. But for the population category that we're really talking about, 55, 60 and older, up to 60% of that patient population is suffering with the effects of dry mouth just from various causes.
Wow. So, okay, and what does that mean? I mean, when you have, what are the effects? What's happening to you when you have dry mouth? Is this the same as cotton mouth?
Yeah, kind of. So the problem is there's a lot of factors as we get older. You know, our bodies stop working as efficiently as they should be. Certain treatments that we undergo that require medications can induce this process. The issue is it really, really increases our risk for oral disease, tooth decay and gum disease. And a lot of people are not aware of that, how problematic their dry mouth is going to be for their teeth. The other thing is nobody plans for the expense of that kind of problem later in life. We don't anticipate that it's coming. We don't financially prepare for it. So it really hits us hard when we're in retirement and we're living on those fixed budgets, and all of a sudden we have these extensive dental bills because of the things that are promoting the dry mouth.
So what does saliva do then to promote our dental health?
Yeah, so many incredible factors that saliva plays a role for us. So first of all, you know, when we're talking about XEROSTOMIA, we're talking about not just the quality, but also the quantity of the saliva that's being produced. So saliva has, its primary benefit is really just neutralizing oral acids. And when we lose saliva, that pH of your mouth really drops into that acidic zone, and then we start to develop tooth decay really rampantly.
My gosh. Yeah. Okay, this is kind of scary. So can't we just drink a whole bunch more water, or what?
Yeah, and that helps. And water is a good buffer. It's not quite as good a buffer to acid as our saliva is, but there are products out there that we can talk about that are more effective. You know, I think that some of the other effects that saliva help us with is there's enzymes in our saliva that help kill the bacteria that cause tooth decay.
Okay.
It also moistens our mouth so our lips and our tongues don't stick when we're eating and talking. You know, for that age category, you know, many people are in dentures or partial dentures. It becomes very challenging to wear those when our mouths get too dry. But just the disease processes that come really are the biggest problems.
Well, I love the causes too, because I think stress is a big cause. You know, sometimes people are so scared on my show that their mouth clicks because, you know, I mean, seriously, there's so many different causes.
Yeah, so let's talk about some of those causes. You know, the big ones that we're seeing today is medication-induced dry mouth. There's over 500 prescription medications that actually induce dry mouth, and people are not aware of that. You know, in that patient population, you know, a person could be on anywhere from 5 to 15 different medications. If you're on 2 or 3 of those that induce that dry mouth problem, your trips to the dentist are going to go up, and so are your dental expenses. There's just no way around it unless we can educate people on how to avoid the effects of that. You know, some of the other causes can be illnesses, autoimmune diseases that attack our salivary glands. Or in this day and age, we're seeing a lot of people who are undergoing therapy for cancer. And so chemotherapy and radiation therapy really, really target salivary glands. And so in the aftermath of surviving all of that, they have the wonderful experience of spending a lot of time in the dental office if nobody helped them ahead of time and after those treatments.
You never think of that.
Yeah.
I would never guess that. Now, some of these things are remediable, fixable. Maybe they're temporary.
Yep.
Once you're done with, let's say, chemotherapy, or maybe if you stop taking those drugs or don't need to anymore, then does the mouth right itself?
So typically not. Usually, a lot of times, depending on what it is, if you come off of a medication, sometimes the salivary glands will rebound and they'll start functioning again. The effects of chemotherapy and radiation therapy oftentimes are permanent, and we have to kind of live with that. And so now it becomes about education and prevention if we want to avoid the treatment that will come along with the problems, right?
Yeah, so how do we do that? We find out what drugs make dry mouth, and so I don't want to, of course, you know, when you hear those ads, the side effects like death, stroke, heart attack, so maybe dry mouth is like less important.
Right.
Maybe it doesn't take the top. But seriously though, how do we go about preventing this? Because it is pretty serious.
Exactly. Let's take something simple. You guys were talking about cell phones and calculators.
Yeah.
You know, there's apps that you can download. Medscape is an app that anybody can download. It's a drug reference where people can go in and they can look at their medications and they can see, am I at risk for this? Oh. Ask your doctor, am I at risk for dry mouth? What should I plan for dentally while we're fixing these medical problems? That's one resource, right? The second thing is just getting education from your dentist. They should be involved in that process. Your oncologist, your physicians, and your dentist should be working to inform you of some of these issues and what the preventive measures might be. Because there's a lot of things that we can do after the fact to keep ourselves decay-free and gum disease-free. But we have to know what we're doing. So fighting acid is the biggest culprit. We have to replace the buffering effect of that our saliva was playing. Sure. We now need an alternative like baking soda. Baking soda in our products.
Is that, so these prevention tips we're talking about, can that, how about chewing gum? I mean, I notice when I chew gum that I mean, are there ways to kick up the saliva if we're involved in this?
Absolutely. You know, anything that will stimulate the flow of saliva will help. There are medications that we can prescribe for people. They're not super well tolerated, but they can increase the flow of saliva. Okay. Chewing gum is another way, you know, those tangy gums. That,
sugar-free?
Absolutely sugar-free, and you want to watch stuff that's too acidic or it'll actually promote the problem.
Right, right.
You know, one of the big mistakes that a lot of people make is that they start sucking on throat lozenges and candies and things like that actually create more sugar in the mouth, increase the acid in the mouth, and promote.
You know, this is something, I mean, I didn't think it was like this big problem, say it again.
XEROSTOMIA.
Anyway, you're having a big seminar that's coming up, and this weekend, is it?
It is. It's actually tomorrow night. February 22nd at the club at Prescott Lakes. It begins at 6 o'clock, hors d'oeuvres to be served ahead of time. But like, you know, what they're doing with the Humboldt School District, you know, education never stops. Yeah. And that's a big role that we play in our community is getting our patients the education that they need to avoid these pitfalls, not just show up for treatment.
And there's so much information, I mean, you really need to get over there. Okay, so tomorrow night, 6 to 7:30, the club at Prescott Lakes. You can RSVP information on the screen, prescottdentist.com. Basically, thank you, Dr. Jason Campbell.
Great to be here.
Fascinating, my gosh, XEROSTOMIA. Yeah, I know a little
You got
Latin.
it.
All right. Don't go away, I've got movie reviews for you next.